Today I want to talk about iron deficiency anemia caused as a result of blood loss from as simple as heavy menstrual bleeding, GI bleed, to more severe diagnoses such as colorectal cancer. For the purpose of this video, I'm just going to focus on the heavy menstrual bleeding. This is Evolve Eve. My name is Evelyn. What is iron deficiency anemia? Iron deficiency anemia is when you have low red blood cell count or low hemoglobin as a result of iron loss from heavy bleeding or blood loss. So basically, there is a red blood cell that helps to carry oxygen to other parts of the body. This RBC, for the purpose of this video, RBC is red blood cells. This RBC has a protein called hemoglobin. And the function of this hemoglobin is that it's to also carry oxygen as well. It's attached to the red blood cell. So there's a specific site where this iron binds. And without this iron binding to hemoglobin, the oxygen cannot attach to hemoglobin. So you can imagine if you have low iron, you're going to have low oxygen as well. When your iron is low, you're going to present with the following symptoms. One of them is going to be tired. Think about it. If you don't have enough oxygen to carry to your head, to your brain, to every part of your organ, your muscles are not able to work completely because they need oxygen. Your brain needs oxygen. Your arm needs oxygen. Moving around needs oxygen. So you're going to feel tired. You're going to feel shortness of breath. Even just climbing 2 stairs, you're going to be so tired, basically. Another thing that low iron does is that it can cause your brain to become so exhausted. So with the brain exhaustion or fatigue, it means the brain activity is going to be really slow. Sometimes you have a period of blankness. You just don't remember things. And the fact, because there's not enough oxygen coming to your brain. And also it decreases the brain activity, which means the hormones such as serotonin in your brain is going to decrease, which is going to decrease your mood as well. So you're going to have period of anxiety and period of depression, basically. And you're going to think, I don't just feel myself today. I'm so tired. You're lying in bed, you're sleeping a lot because you just feel you're tired. It's because you probably don't have enough hormones. And specifically for women, during your period or after your period, that's when you feel this exhaustion, basically. And that's not good, really. Another thing that low iron does is that it affects your hair. So you're going to have period of alopecia. Your hair is not going to grow. So people who have low hair, whatever, low, I don't have hair. It's a natural thing. It's an African thing. My mom doesn't have hair. My sister doesn't have hair. That is not true. You need to check your level of your irons, or specifically if you're a person who have fibroid and you're having heavy menstrual bleeding, you should check your iron level. Get your blood salt, get your blood work done, check your CBC differential, check your hemoglobin, check your RBC, check your hematocrit, and see why. If you're having low iron, basically check your thyroid stimulating hormones, because low iron can also trigger to decrease your thyroid stimulating hormones, which will cause decrease in metabolism as well. So iron is very important. So you can take medication for iron daily or every other day, and also ensure that you're taking vitamin C, because vitamin C will help to absorb the iron better in your system. Or you can eat food high in iron such as spinach, lentils, soybeans, liver, tofu, basically green vegetable. So make sure you're taking all of that food. And if you're presented with any of these kinds of symptoms, I suggest and I recommend that you follow up with your doctor to get yourself checked. And